Broadcasting from the business capital of the world, this is the Podcast Business News Network.
Hey, welcome back, everybody. So excited to do what we're going to do today and learn about something you've heard about. I guarantee you've heard about it, but really don't know a lot about it, but it can help you feel so much better. And that is acupuncture. She knows about it. She also knows about hypnotherapy, functional medicine, NLP, and so much more. Dr. Cecilia Cervantes joins us on the program today. Cecilia, how you doing?
Great. I'm happy to be here.
Happy to have you here. And it's in the back of my mind. I'm always thinking about acupuncture, and many people tell me, and you tell me if this is true, that it's the last thing a lot of people go to. They try this, they try that, and then it's like, yeah, I'm going to try acupuncture now. Does it usually happen like that?
It happens that way quite a bit. They don't think about it. And then when you mention it, it's like, yeah, well, why didn't I think of that
Exactly.
before? Yeah.
What are some challenges that acupuncture can help you out with?
Oh, so many things, especially pain issues, acute pain, chronic pain, arthritic pain. Um, it's great for hormonal issues, menopause, fertility, uh, for going through labor,
Wow.
allergy symptoms. It's almost everything. So many things can be affected by acupuncture. You can use it for a lot, and you can use it in conjunction with other things. It's a great, alternative that you can do with other things, with physical therapy as well.
So let's get the big thing out of the way here,
Yes.
the needles. Everybody always focuses on the needles. What do you really feel? A little bit of pressure, what?
You feel some pressure. You might feel, a little sharp pain at first, and generally they'll stimulate the needles a little, moving it, and so you may feel that little ache, but it doesn't last. Um, the Asian acupuncturists, especially from China, they will sort of be more aggressive with it,
Mm.
and Chinese people are used to it. They're used to expecting a lot of pain and pressure when the needle is inserted. So I've had it from many kinds of people, and some Chinese acupuncturists who really just they aggressively put that needle in. So it's a little, you feel it. You're like, what's that? But generally, it's not that painful.
Thanks for being honest about that, because all right, you might feel a little bit of pain, but guess what? Your pain will go away. The other pain you had while you went for acupuncture in the first place. What are the expectations? Let's say that you have this is going to be hypothetical, but a chronic shoulder pain. You've tried, medication. Let's say it's bursitis, maybe something like that. If you have acupuncture, you get relief. How long does the relief typically last? Everybody's different, but just kind of curious how long it could last.
Yes, it depends on the person. You might get some immediate sensation of relief, and then you'll go back perhaps a few times, once a week or twice a week. If it's bad enough, you may go there twice in a week
Wow.
to help that. It reduces the inflammation, and that's what gets rid of the pain. That's what helps with the pain, is reduction in inflammation. So depending on the person and how long you've had it, so everyone's different. And but most people, not everyone, will see improvement, which is very encouraging.
What's actually happening when the needle is inserted? How does it relieve the pain or help you out?
Well, the theory is that it relieves blockages. They put the needle generally in specific points along what is called a meridian, and these are energy channels. So what you're doing is you're relieving the blockage and increasing the flow, a flow of what they call chi, which is the life energy. And with that, you are also releasing perhaps some endorphins. And so there's some chemical reactions that occur also that help with reduction in that pain. And of course, the reduction of inflammation. There are lots of studies that have been done on acupuncture for many years, proving that these things actually occur and that it is very effective.
Are there times when acupuncture is done, but nobody feels the benefits of it?
Of course, there's always some people that won't feel any benefits from it, so you have
Doesn't
to be open to doing it, first
doesn't
of
happen
all.
often though. From
I don't, I don't know the statistics on that. Most people that I've sent for acupuncture to an acupuncturist uh, report improvement. They report some benefits. Uh, for certain things, such as fertility and hormonal issues, that can be varied, of course. So, and it also depends on what else is going on in the person's health. We're looking at a holistic practice, and we have to look at the person in a holistic fashion. Acupuncture works well with the combination of herbs additionally, and then watching your diet and making sure you're well hydrated. So there are a lot of different factors involved there.
Hmm. I'm learning a lot and I'm loving it. These are all the questions I always wanted to ask. How many needles do you have to put in? I hear varying reports, anywhere from, oh, you only, again, it depends on what we're treating. But, if you want to give an example, that's great. Let's say you're helping somebody with a certain issue, but I hear things between like 3 needles can get the job done, then up to like 12. Is that true?
It's true. It varies. It depends what you're treating. And you may be treating a variety of different symptoms.
Hmm.
So if you want to catch them all, you may need a few more needles. It really is an individual treatment plan that's given to each client, to each patient. So we don't put everyone in the same basket. There are some general points that are good for overall wellness and balance. Um, how many are used? It really just it depends.
Hmm. Could it be as low as 3?
It could be.
Hmm. How do you
It could be.
know? How do you know how many to put in?
Well, it depends. You get a history and you do a little physical, and you may do what is done in Chinese medicine is they look at the tongue, they check your pulse, they do a tongue and pulse diagnosis. They look at everything, your overall wellness, and depending on what's going on with you, they may do it in different sections. So at first they might just want to lower the volume of whatever it is that's going on, and then decide like which points are the most important ones to treat at this point, at this time, that's going to give some relief to the symptoms. So depending on what the symptomatology is, and you could have symptoms in various different areas, different systems. So
Hmm.
it really is very individualized.
I'm going to get very granular for a second here, and these are all the questions I wanted to ask, and other people probably think the same thing. At least I hope, or maybe it's just my mind. But how do you know that you're hitting the target? So let's say you pick a meridian or an area. How do you know you're there, or is there a wide area where you have to place that needle?
Generally, the area that's needing treatment is going to be tender. So the acupuncturist will always
Oh.
touch that area. And if there's tenderness there, they say, okay, yeah, that's a good area. And it'll be in the area of the meridian. So they get very good at finding the points that need to be treated. And
Hmm.
they're pretty specific, in that general area. But the point will generally be tender. And that's it.
Had no idea.
Yeah. And
None
you might
whatsoever.
treat around the area too, also. So it depends. Yeah.
So we have a test subject over here.
Oh no.
Are we using this
Oh,
person today? Yes.
this is my little friend here, and you can't see it really well, but he has all the points on his body there,
Wow.
all the different meridians. And so there are quite a few points that can be used. And it goes from the feet all the way down to the scalp, to the top of the head.
Wow. Is there anybody that should not be getting acupuncture treatment?
Well, someone who is perhaps very, very sick and very, very weak, uh, it really depends. There are some contraindications, such as if you're on a blood thinner, um, you want to be careful with that. Uh, if someone has an acute infection, acupuncture can help with that, but you probably want them on an antibiotic at the same time, potentially. If they're acupuncture can be used for acute situations. There is a point if someone kind of passes out or whatever right here under the nose that you can needle to bring them back. So depending on the experience of your acupuncturist and their ability to handle emergency cases, that's really what I would depend it on.
Can you use acupuncture for anxiety?
Oh yes, for
Wow.
anxiety and stress, um, for depression. Yes, you can use it for all of those things. Yeah.
What what motivated you, Cecilia, to learn acupuncture?
Well, I always wanted to learn acupuncture, and I don't practice it readily right now, but I do send a lot of my patients to acupuncturists that I know and that I trust. But I did study, and around 2006, I wanted to learn, about the meridians and about alternative medicines and energy medicine. It's a different kind of treatment, and with different philosophies. But it's so old. It's over 3,000 years old and continues to be used and very effective. And I know that a lot of my patients, I knew that a lot of my patients were using acupuncture. So I felt the need to find out more and to train. And so I did um, in a medical acupuncture program. And it was excellent. And so I am able to do acupuncture if I want to, and I do it on myself sometimes. But there's different things you can do. You could do it on the body, and there's also auricular or ear acupuncture, which is you can do some quick treatments or in conjunction with the regular acupuncture, and you can even leave some of the needles in little tiny needles you leave in the ear and allow them just to fall out. They use auricular acupuncture for substance abuse disorder, and it works quite well for that, people who have addictions. And they're even using it now in the military battlefield. They call it battlefield acupuncture, and they use it quite a bit for pain. And acupuncture is amazing for pain.
You find it fascinating that this is something that the Chinese figured out 3,000 years ago. They, it is, I find it kind of amazing that that was discovered how this actually works.
Yes, I think they used it in conjunction with battles and things. They were treating soldiers, and they were needing to treat them. And how do you treat pain and different things out there in the field? And for during the early 1900s, it sort of went into decline because uh, the Asian countries were becoming more interested in Western medicine. And so it wasn't used as much, but they realized that it was necessary, especially in China during when the communists came in. They realized that a lot of people weren't getting treated. They didn't have the doctors there, and so they trained what they called barefoot doctors to treat people in the outlying villages and use acupuncture, again, acupuncture and herbs, to get people better so they didn't get so acutely ill. So there's an interesting history around it all.
And you mentioned twice now using acupuncture in conjunction with herbs. How do you mean?
Well, a lot of Chinese herbs that have been used at the same time that use acupuncture. So someone will go in for an acupuncture treatment, and then they'll leave with a bag of Chinese herbs, and you can take them in pill form. And some people will kind of boil them down and drink them down, very very bitter.
Mm.
uh, in China, people they'll drink it. They drink it, and they put up with the horrible taste. In Western countries, we don't tolerate it as well. So mostly in pill form. But there's a lot of Chinese herbs that help and that you can continue to take to help with the effects that you're looking for. So longer term effects, depending again what you're treating. If you're having hormonal issues, you want to treat in between acupuncture treatments and affect the change that you want to get by this ongoing taking of these herbs that have incredible effects on the systems.
So if somebody were to come to you or go to a acupuncturist, would they direct them on the herbs to take? You know, sort of like a package deal, do the procedure, and then really educate them on the herbal part of it.
Most acupuncturists are also trained in herbalism, and they will also add the herbs and direct the patients, clients on how to the herbs, um, and also have them get back to them if they have any bad effects, so they can change things up, make sure that their tolerance is fine. Some people tolerate it better than others, so just like regular medicine. You can tweak it.
What about insomnia?
Yeah.
Would that work?
Oh, yes. Insomnia, acupuncture, yes. And then herbs, especially. There are lots of wonderful herbs that help with insomnia that you can take before bedtime in the form of a tea or in pills or whatever. Um, yes. So that you're not having to take something that is habit forming. It's preferable. And it depends on the type of insomnia you're having. Some people can't fall asleep right away. It takes them a long time to fall asleep.
Hmm.
And sometimes it's because their mind is going, they've got this mind chatter and they're trying to solve the problems of the world right before going to bed, you know. So there are specific herbs such as passion flower, which is wonderful for that. So depending on the type of herb, there are some women who have insomnia that causes to wake up at 3 o'clock in the morning, and that's usually due to menopausal symptoms. So there are specific herbs that you would treat for that, and you would treat with some herbs that help with menopause as well. So depending on the type of insomnia you're having, there are specific herbs for that. That's the beauty of it. Yeah.
If somebody's looking for a an herbalist, I'm sorry, an acupuncturist, what should they look for? Is there certain certifications? I wouldn't even know where to start.
Well, they are licensed here in the United States, so they have to have a license.
Okay.
Um, and so, of course, you look for the license. Uh, there are some who get a master's in acupuncture, and then there is also a degree of a doctorate in acupuncture. So depends on what level of training you're looking for, and you want to make sure that the acupuncturist you go to is someone that you have rapport with and you can ask a lot of questions of, and you have the time to really get to know them and know that they're interested in treating you, the usual stuff with any practitioner. You want to know that you can trust them and you can ask them anything.
So let's talk about the session itself. Should you be doing anything before you go into the session? And what about coming out of it? Will there be some tenderness where the needles went in?
Yeah, where the needles went in, you might have some tenderness, some bruising, a little inflammation. That should go away generally. You you don't have to prepare in any specific way, just go with your list of what you want to have treated, what's going on with you. Be open and honest with the practitioner, let them know everything that's going on with you. Let them know what medications you're on, especially if they're going to use herbs on you,
Mm.
because there could be some issues with medications and the herbs. Um, know that after this session, you might feel a little groggy at first. So you should wait a little while before you get up and go off and drive in your car because it's so relaxing.
Ah.
Um, so those are the kind of things you want to look for. Of course, the needles that are used should be single-use needles unless they are using special needles that they autoclave and sterilize. but most acupuncturists will use single-use needles, comes out of a packet, you know, they're not reusing needles. You don't want that at all, of course. And
I just, as
I've never heard of anyone having that be an issue.
you know, so many more people would do acupuncture if it didn't start with the word needle. If another word was used back in the day, you know, if we called it sticks or whatever, just a different word other than needles. I think that's where such a major aversion comes from that for acupuncture. You know, we're afraid of them. A lot of people are.
In the Western world, we're kind of weenies when it comes to that sort of stuff.
It's true.
You
You're
know what I mean?
oh, I
I
know.
mean, it's just a needle.
You're Listen, Cecilia, you're talking to somebody who has a script for a routine blood test. Haven't had one in like a couple of years, and it's on my sun visor, and it's been sitting there for I don't know, maybe like a month, 2 months, or whatever. And it's like, yeah, all right, I'm gonna wake up early tomorrow morning after fasting and go do it, and I haven't. And I just said before Monday I'm going. It's you just put it off, and you shouldn't. It's important, you know.
I had an idea you might have an aversion to needles, but you could always do some hypnosis for that.
Of course, yes. But I have to tell you, as I get older, the aversion go. I would go if you said right now, "Hey, let's do acupuncture." 3 p.m. appointment. Honestly, would show up. I wouldn't even have a problem with it. I really wouldn't. It's and how come? Because of the education. You know, you learn more about it. That it's the size of a hair. You might feel a little something here and there. It's not like you're getting stabbed with a needle. Thank you for telling me about the Chinese tradition where they do jam it in. It's good to know. But most people are gentle. You know, and I'm sure if the acupuncturist detects that you have a little bit of a fear, they're going to go a little easier on you.
I think so. It's such a relaxing thing. Whenever I go, I know that, I'll get a few needles in, no problem. And then I'm gonna lie there for a while. They'll put some quiet, gentle music on. So you go into a very relaxed state, like a meditative state, and you can just lie there and relax. So you get a break in that time. You
Yeah.
get a break in your day. A lot of people look forward to it.
You brought up a really good point. I don't think we talked about that before, but when you have the session, you're on the table, needles are placed, so you wait a period of time after that. Typically, how long is that?
Well, it depends. To leave, 5, 10 minutes, 15 minutes, depends. They'll have you get up slowly and they'll be there with you to make sure that you're not too dizzy because it can cause maybe a little lightheadedness. And then have you wait for a little bit. Some people, they can get up and go pretty quickly. They're so used to it. It's not an issue for them. And it depends. It
Hmm.
depends on the day. If you've had a long, hard day and now you've had a chance to relax and let go, you get up slowly and then you just give yourself enough time to go. We live in this rush world. We got to learn to slow down a little. This is what brings on a lot of the stress. It's like take it easy.
Yeah. Well, you brought it crystal clear when you said that it's relaxation. You're going, you're getting a treatment, but at the same time, what are you doing? You're laying on a table. That's not can't be so bad,
Yeah.
right?
Yeah, it's not so bad. Just we need to learn how to relax and take it easy and not, jam our day full of things to do, it's that's where the overwhelm comes in and we overload ourselves and create more issues and problems.
Do you
Um,
think that that really is a product of our culture? That's the American culture.
that's the American culture. I mean, you live in New York City, the rat race city of the world where people are running wherever they go. Run,
Yep.
you know. Slow down, take it easy, learn to meditate, learn to relax and go within and be in the moment. It's such a nicer space to be in.
You don't truly realize it until you talk to other people. And over the summer, I was at an amusement park Kids are going on a ride. I figure, I'm gonna sit this one out, get something to drink. I'm gonna hang for a little bit. Met a guy from the UK. We start talking. He's a police officer, and we talk about vacation time. And I said, yeah, typically, get a couple of weeks here. It almost looked like I was speaking a foreign language that he didn't understand. He's like, "Are you serious?" I'm like, "Yeah." He goes, "I'm on holiday and I'm up to week number 5 and I have another 2 to go." Like, what? And that's standard. That's what they do. That's, it yeah, we're doing it wrong over here. We definitely are.
Yeah, we are just we keep the metal to the pedal. Long term, it wears us down.
Yeah.
We need time to restore. We need to do things, to help restore ourselves
Yeah.
back to vitality. They take like a summer. They take the summer off, or a month off. Yes.
Yeah. Yeah. Could you imagine? I really can't.
I know it would be wonderful.
Be
I
nice.
may not want to go back to work though. No, that's not true.
Yeah.
That's not true.
Well, we fantasize about that, but I couldn't do that either. Even
No.
talking to the retirement word someday, it's like, really, I don't even know what that word means.
It doesn't exist in my vocabulary. I don't even know what it means, because I'm always needing to do something and study something, read something, just keep going. I'm not gonna, sit on the couch and watch the boob tube all day. I'm not sure what people do in retirement, or I don't know that it's even healthy for people. A
You
lot of people a
Yeah,
lot of people I see in retirement, they're spending most of their time going to the doctor's office.
you know, that's a really good point. I never thought about that, but yeah,
Yeah,
people I know that are older, that it's like, "Oh, I have another appointment planned." I mean, okay, great, you're taking care of that, but maybe there's a reason for that. I mean, I'm not saying we should be, crazy pedal to the metal either.
right.
You look at seniors when they start slowing down, like truly slowing down and losing their purpose in life, that's where their health and everything starts declining. So yeah,
Yes.
something to be said about that. Thanks for our talk today on acupuncture. Learned so much. These are all the questions I wouldn't even know who to ask, and now it's you, Dr. Cecilia Cervantes, and myquantumheal.com. You offer so much in terms of many different healing modalities, hypnotherapy, NLP, and on and on and on. Definitely go to the website, and if you're looking to get healed, talk to Dr. Cervantes. Thank you so much for being here today.
You're welcome. My pleasure. I love it.
Yep, same here. We'll talk very soon, okay?
Okay.
Thanks a lot. We'll be
Have a
right back.
great
Broadcasting from the business capital of the world, this is the Podcast Business News Network.